c'est un docteur
in America,
aux États-Unis.
and I have been to Haiti 2 other times to help serve Haitians.
Il est venu en Haïti déjà.
Today I come with help from the university.
Jodi al venu avec aide des étudiants de l'université aux États-Unis.
With 5 students that are doctors.
Il y a 5 étudiants.
We're in T Riviere doing our afternoon clinic. While some of our other clinics have been in schools and churches, this building actually functions as a clinic most of the time with a nurse that is an American nurse who is here a lot of the time. So these are some of the locals who have come to be seen today. Sometimes patients will walk for hours to be seen by a doctor that they've heard through the grapevine is here. Patients are seen by our triage team and their vitals are taken and their complaints are taken. They can be treated for a lot of problems just by the triage team alone. Pain, they can be giving worm medicines and vitamins by the triage team. But if their problems appear to be serious enough, they are taken to another room to be seen by one of the clinicians. So the next patient to be seen is going to be seen by Jess, our free clinician. You can see in the room. You can see in the room right now we have 3 medical students seeing patients in this room alone. So we just have set up makeshift stations for all of them with as much equipment as we can get near them as we can.
I'm not quite sure how old he is, but was burned by a hot pot about 3 weeks ago. Hasn't been treated. It hasn't been cleaned. It's very infected. It looks like it's spreading to the other leg. It's tachycardic. He has a fever. Well, we were worried he had the infection in his blood already. He had a temperature and he was tachy. Seemed to get a little bit better today. So I mean, if it got bad enough, I mean, he could lose part of that leg, or he could die if he became septic. We cleaned it up. It looks pretty good. Started him on some antibiotics. I think he'll do fine.
You blacked out, you had a moment where you don't remember anything?
This is a girl who was in a motorcycle accident 2 days ago. She did see a doctor. She has a laceration to her right cheek. It looks to me more like it's a lot of abrasions. Could be more of like road rash. But the other thing is
bottom line is you need some water. You need soapy water with a basin. Right?
With the basin. And with the gauze we have though, I want almost like a Chlorhex sponge. With the gauze, this is so rough. I don't want all that gauze to tear off into it. We don't have sterile water, so we're just using some soapy water right now, and then we will add some iodine to it just to initially clean it to see what we're dealing with. And then, so she has an infection that's starting underneath her existing stitches, and so we're cleaning it right now to see if we have to reopen the wound.
I'm sorry.
This is most likely a cancer. Does she know what cancer means? Okay. So these cells are going to grow and grow and grow, and they will rob your body of life. But we can feel the problem has has spread into this area. There's also cancer in this armpit.
Okay.
It has grown from the area in her breast into the areas in her armpits. With this diagnosis, I do not think she will be alive in 2 years. Dear Heavenly Father, please reach down and touch this woman. Please help her to journey the rest of her life and know that each of her days is meant to have a purpose, that we can learn from her, and it can motivate us to be better people as we treat one another. Let us love her.
You guys are really, really strong people. And I think about you a lot. And You teach me every day how to be a better person.
Chaque jour, nous apprenons comment devenir plus bon monde. Chaque
So I will be back in February.
La retourner en février.
When I get off that bus,
Là qu'elle sortit dans le bus là.
I can't wait to see you all again.